region. So great to see loads of people. Just to remind people, this is around climate change and the public sector, and it's about placing sustainability at the core to delivery of better services and support to support a healthier population. Just some apologies. First off, we had a colleague, Carolyn Wood from Northwest Ambulance Service, that was going to join us today, but unfortunately, Carolyn has had a personal emergency and is not able to join us today. So we've only got 3 speakers today instead of 4. So apologies for that, but we have got Caroline's slides, so we will be sharing all the slides from the presentation today. We're also taping this, we're videoing the actual call, so we will also share this the video for everybody to sort of share and learn from as well as we go along. So this is the agenda for today. So we've got Fiona, Tom, and Lindy. So I'm going to bring those colleagues in just to do a quick introduction about themselves and what they do. So Fiona, can I start with you? If you'd like to just intro yourself.
Hi, my name's Fiona Reynolds. I'm Deputy Regional Director with Orchid Northwest. And that's part of the Department of Health and Social Care. Whenever I'm doing these introductions, I always think I've got rubbish Scrabble letters in terms of an acronym.
Tom, can I bring you in?
Yeah, I'm Tom Smart. I'm from Natural England, and as it says on the screen, I'm a senior officer in the Cheshire Lancashire area team, but I work generally on 2 projects. So one of which is the Liverpool City region local nature recovery strategies. So you might have heard of those, or LNRSs more generally. And if anyone does want to get in touch about those, please feel free. I also work on the Bolin to Mersey Nature Recovery Partnership, which covers sort of southern Greater Manchester and northern Cheshire, in that sort of corridor between the Bolin and the Mersey, as you would imagine. And I'm going to be talking today a bit about a couple of projects that we funded through that partnership on that related to health and climate and nature.
Thanks, Tom. And Lindy, can I bring you in to introduce yourself?
Thanks, Helen. Morning, everyone. I'm Lindy Wardle. I'm a service manager over at Wigan Council, so commissioning lead and quality lead for our home care and supported living markets.
Thanks, Lindy. So today we have got these 3 speakers that are going to take us through some slides about all the work that they've been doing, and then hopefully we're going to have a short break and then go into a panel discussion about what you've heard and hopefully take some questions from people on the call, which is great. Before I bring Fiona in for the first part of the session, as probably everybody is aware, the climate is changing. It's having a major impact on lots of communities and lots of individuals. And I suppose the session today, the focus and objective is looking at how that impacts on what we do across health and social care. So we're really wanting to explore today some of the data and evidence about how the climate is impacting on the work that we do across both health and social care. We're going to be looking at what local authorities and health organisations are doing to prepare themselves for the changes that are occurring, and hopefully we're exploring some opportunities about how we can collaborate together and sort of do some work around tackling this issue going forward. And I think for most people on the call, we are working with some really vulnerable people and populations, and these extreme weather events are actually going to impact quite significantly on communities and individuals, and we're hoping today to explore some work that colleagues are doing about how they're tackling that. So that's the basis of what we're trying to do today. So hopefully we'll get into a really great discussion towards the end in that panel discussion. Okay, so that said, I want to hand over directly to Fiona, who's going to take us through her presentation. So Fiona, can I hand over to you?
Yeah, definitely. Thanks everybody for joining this call, and I hope you will find all of the content and obviously the bits I've pulled together useful and interesting for the work that you're doing. So I'm going to be talking about the Northwest Climate and Health Narrative, and I'm also going to be talking about the Northwest Public Health and Environmental Sustainability Collaborative. First thing I will say about the collaborative is that it is not a public health group. It is there for anybody who wants to work with us on the issue of climate change, environmental sustainability, however you want to call it. So on to the next slide, please. And this is one of my faffy slides, so click again, and again, and again, and again, and again. Thank you. Oh, back, sorry. So what I want to cover this morning is we're going to have a little bit of interaction with Ask the Audience. I'm also going to talk about the climate change and health narrative in a little more detail, but not a huge amount, because I thought it would be really tedious to take everybody page by page through the report. And I'll also talk about the collaborative, and then there's an ask and an offer to the audience as well. Now, we don't usually come bearing gifts, but there's one for your attendance here, and then any questions, but we may pick up some of those in the panel. Looking at the pictures on the side of this slide, the reason I included these is I was thinking about the way that we present a lot of the narrative around climate change and environment, and it always tends to be presented as something happening elsewhere. And I was recently at a conference where the opening speaker said we need to sack the polar bears, which I thought was quite a sharp message to the audience, but the reason behind that was, well, polar bears haven't done a lot to motivate us around climate action, so maybe we need to remove them as the poster child. But anyway, on to the next slide. And this is where we've got a bit of audience participation. If you can use the QR code to join the Slido discussion, or if that isn't working for you, you can go to slido.com and there's the joining number. I will just pause there before we move to the next slides to give everybody a chance to grab that. I think we'll be swapping slides in a moment or two, which should be seamless, I'm sure.
We are up and running, Fiona. So
we're up and running.
We've got Slido ready.
Brilliant. Okay, we'll move on. So when you talk about sustainability, what do you mean? That's your first question. Is this in relation to your workplace? Wherever you talk about sustainability, what does that word mean for you? Fab, we've got a few answers starting to pop in. Oh, I really like that one about thoughtful actions. Lovely. Yeah, we've got planning with future in mind, creating a better world, environmentally friendly, continued survival of the planet, triple bottom line, preserving resources. Yeah, lots of stuff in there. One of the things I may remember to mention when I'm talking about the collaborative is we've recently had a name change to include the term environmental sustainability, because when we were talking about it in other meetings, people assumed we were talking about financial sustainability. Next question, please. So, which of the following phrases would you use to talk about climate change? You've got 4 options there: environment, sustainability, climate change, pollution. Fab. We've got a lot of support for climate change there, or a lot of use of climate change. I included pollution, having read a book recently where the author was saying that to get people more engaged in climate change, actually you should talk about pollution, because that has a very meaningful, immediate impact. You can see the signs of pollution, whether it's the litter on your street or the smog in the air. And their argument was that that was a more useful term. So next slide, please, or next question. How is the issue usually talked about in the UK and in the health and social care sector particularly? Do we talk about it? I gave you some easy answers there with my commentary. Yeah, this is really, really helpful stuff. This tallies with a lot of things that I've been hearing for people in terms of it's not really talked about. We focus on the money. It's a little unclear. It's a little abstract. We talk about net zero. And yeah, as somebody's highlighted, it's usually relegated as a nice to do. Okay, let's move to the next question. So what's the health and social care day job? Yep, patient safety and care, better lives for people, sustainability program manager in an ICB. I think I know who wrote that. Hi, Mandy. Better lives for people, caring for people, supporting. And it often feels that climate change, sustainability, pollution doesn't have a place in that, doesn't it? And it's quite hard to think, well, how do I address that when I'm doing all of this as well? Completely understand that. Okay, next question. Does anything stop us taking action on environmental sustainability or climate change? I imagine a couple of people will say everything on the previous slide. Yeah, finances, apathy, budget. Yeah, we're seeing money a lot here. Time, knowledge. Yep. Not considered urgent. Buy-in. Yep. I'm hoping we can keep these slides because these are very, very useful. So thank you.
I'll collate for you to be shared.
Oh, brilliant. Thank you.
With yourself and everyone.
Fabulous. Okay, it requires leadership buy-in and everyone is too busy. Automatic saying no. Yeah, brilliant. We'll move to the next question, please. But I can see that time, finances, money, knowledge are the key ones there. Do we need to change the focus? Yeah, we've got a strong yes there. Very emphatic yeses. I should have added a question that says, how do we do that? But, you know, that's probably not for right now. But yeah, make it personal, involve communities. Oh, brilliant. Some fabulous answers here. Make it align on strategy. Sorry. Yeah, biggest threat to health, also core benefits. Yes, there's definitely a lot of core benefits in addressing this issue. And spoiler alert, I think Tom will be covering a lot of these, as will Lindy. Okay, next slide, please. This is a bit of a mischievous question. What's your gut reaction when somebody wants to talk to you about climate change, the environment, or sustainability? Now, the fact that you're all here is wonderful. Oh, excellent. We've got some excitement as well in the chat. Lots of enthusiasm. Yeah, as a climate change officer, thrilled. Oh God, they want to save money. Yes. It's usually like that when they want to talk about public health as well. Bit of apprehension, fear, anxiety, completely. Supportive, relief, and enthusiasm. A real mix of answers there. Wonderful. All right. Thank you for your answers, and we'll go back to the presentation. So I said I would talk about the climate and health narrative and the collaborative. So if we go to the brilliant, so the climate narrative. So what I wanted to say on introduction to the climate change and health narrative is that what became quite clear in developing this work was that there was a lot of people working across the Northwest asking for a shared narrative, a shared view on what the impacts and what the issues were going to be for health and well-being in the Northwest. The aim was to create a central resource that we could all use, that would be endorsed by the Northwest and would include actions around mitigation and adaptation to guide us through the work. So that was why we created it. So this slide highlights exposures, sensitivities, adaptive capacity and social vulnerability to climate change with how those three elements impact on the vulnerability. The Chief Medical Officer highlights that the key risks for the UK are increasing temperatures and flooding. And these two key factors, there are others, but Chief Medical Officer has highlighted these two in particular. So the impacts on health include the increased temperatures. These can have impacts on individuals' asthma, respiratory infections. We see that there's an increase in asthma exacerbations during heat waves, but also during cold temperatures as well. Increased extreme weather events create sustained pressures and impacts on health. We also see the risk of rising sea levels and coastal erosion. There was an article in The Guardian yesterday which was highlighting this. So in line with some of our colleagues who said on the earlier slides that they felt a little anxious when talking about climate change, I foolishly went away and had a look at sea levels. Well, parts of the UK that are meters above sea level, and my conclusion was that maybe I should think about moving to Buxton. It's the highest market town in the UK. I'm not saying that the entirety of the UK will be flooded at all, but we have a lot more low-lying areas than I was comfortable seeing on a map over my lunch break. Probably shouldn't have done that. The other issues are around air quality. Again, those impacts on respiratory health, but also on cardiac health as well. Impacts on food supplies. Another gruesome headline in the Guardian today was around shortages of chocolate, but also we need to be thinking about where wheat is produced and maize. We've got impacts on infectious disease. We've got a session coming up in July with the collaborative looking at vector-borne infections, which is related to insect transmission. And a conference I was at recently, the speaker said that the main action to reduce the risk of vector-borne infection was to address our greenhouse gases. And then finally, you've got the impacts on mental health. You've got some of those we've already highlighted in terms of the sense of anxiety about talking about climate change. We know that we've got issues around eco-anxiety around a large part of the population, but also sustained high temperatures, sustained cold temperatures also impact on people's mental well-being as well. So next slide, please. And I think this is another faffy one. So within the document, we've also highlighted that we're talking about adaptation and mitigation. Mitigation describes action that reduces the extent to which climate change occurs. And an example of that is reducing the amount of greenhouse gases that are emitted. Adaptation is referring to actions that anticipate the negative the negative impacts of climate change that could affect health and communities, and act to protect the population from these impacts. Next slide, please. Right, so don't click on another one yet. So this slide gives you an example of the content that we have in the narrative document. So we've got examples of how increased rain and extreme weather effects can affect people, highlighting issues around houses, vulnerability to damp and mold, and how that can impact on asthma and chronic obstructive pulmonary disease. Next, click again, please. We've got impacts on food as another example of the content in here. Impact, issues around quality of harvests, what the impact is in relation to cost of living. Another click, please. And then as we describe some of the impacts, we also include key messages around actions that can be undertaken. This one's looking at increased temperatures. Click again, please. And again. So the aim of the document is not just to describe what the problem is, it is to try to outline a number of solutions. And what we've done is include key messages around those solutions and also links to additional resources that people may find useful. Next slide, please. So where can you find it if you haven't already read it? It's available on this website. It's hosted by the Association of Directors of Public Health on their Northwest site. We do like acronyms, don't we? And they're never easy with it when you have to reel them all off. So I do have to give huge acknowledgements and thanks to Sarah Kipps, who actually wrote this document and pulled it together with a working group. And I'm also going to acknowledge Public Health Wales, NHS Scotland and ADPH Yorkshire and Humber, who I've used the phrase inspired the content, but if I'm honest, we robbed them blind because they've produced some excellent resources, and you will also find them linked to in the document. So next slide, please. This is where I will talk about the collaborative. It was set up by the Northwest Directors of Public Health, who recognised that climate change is a big issue affecting population health, the public's health. And we decided that the membership would be not only public health practitioners, but it's for anybody who wants to work on the issue of environmental sustainability. So the membership, it's very organic, which I think is quite fitting for a climate change group. Our membership includes universities, it includes acute NHS trusts, it used to include CCGs, but now includes ICBs. We've got people from councils, whether working in public health or working in place regeneration, people who've got climate change as their job title. Will basically work with anybody who wants to get engaged with the work that we're doing. Next slide, please. So we undertook a review of the group because I think it is important to work out why we're doing anything. Is it serving a purpose? Is it valuable? So having run this group for a couple of years, we looked at what the benefit was. We do know that there are a lot of sub-regional groups that are taking action around climate change. Lancashire and Cumbria have the Climate Change Community of Practice. There's a Climate Change Collaborative in Cheshire and Merseyside. Liverpool City Region have a Climate Change Partnership. GM has the Climate and Air Squad, a GM adaptation strategy, GMCA challenge groups. There's a lot going on, but the view was that there is actually a role for a Northwest group in terms of sharing information. And one of the members said this allows us to hear voices outside our own sub-region. There's some really good practice taking place across the Northwest. So the regional group provides a place where Greater Manchester colleagues can hear about what's happening in Merseyside and all the way across the sector. It also allows us to create a regional consensus, and the the narrative document that I just described is one of the examples of that. One of the comments in the review was that it enables mutual, that includes emotional and practical support for people who are working in isolation on this challenging agenda. As we highlighted at the start of this session, some people can feel quite nervous, anxious about working on this agenda. If you're working in isolation in one organisation, it's good to have a support network. And in January, when we had this meeting, there was some international events taking place. I can't think what they were, something to do with an election somewhere, where, you know, that's going to have quite a shift on what happens around this agenda. And people were highlighting the need for a space where you could actually talk openly about your concerns around that. And the group has also enabled the development of broader relationships. We're working more closely with the academic sector, and it's also somewhere we can discuss policy changes that could have an impact on what's happening in the Northwest. So next slide, please. So the way that we work, we do seek to contribute to and influence national policy where that opportunity emerges. The main thing is that there's been a real development of working relationships and trust across a range of sectors and geographies. It does provide some very good learning and development opportunities, provides that peer support, and it is a collaborative space to work on common issues. So previous work has looked at food sustainability. We've looked at health impact assessments and therefore action plans for hospital trusts and also ICB areas. And as I've already mentioned, it's collaborative space, opportunities to showcase good practice and information sharing about any current and upcoming national policy. We do link in with national government and other organisations to share information. How effective have we been? Well, we've got the narrative. We are working on other products as well. It does support continuing professional development through those learning sessions, and we also have an NHS Futures site, which means that we can all collaborate with it. It's probably one of the only resources, the NHS Futures site, so that enables anybody, no matter which organisation they're working in, to collaborate and also to share the resources that are out there. Next slide, please. So this is what's coming up this year, and some of it has already been delivered. So we meet quarterly. It's a Teams meeting. There has been a request that we do meet together face-to-face once a year, venue to be agreed. But the April meeting, indoor air quality, that was a cracking meeting. We had a number of speakers. We had examples of work in Wirral with the Cool Wirral programme and their log burner campaign to change behaviours. We also had Douglas Booker, who's the North and Midlands indoor air champion. His work is around looking at how we do adaptation without making any situations worse. So for example, he's concerned about the drive to ensure that buildings are not releasing any heat, not losing any heat, but then what does that mean for the indoor air quality? And our other speaker was Ian Sinner, who's a respiratory consultant at Alderhay Children's Hospital, and he was talking about the work that he does with landlords around improving housing conditions, addressing damp and mould, once he's seen families with children with really quite striking asthma. And that session is available on the NHS Futures site, so we did record that if anybody would like access to that. The July meeting will be looking at vector-borne diseases. Colleagues from Wirral were particularly interested in this. We've got retrofitting and probably a bit on housing and efficiency at the October meeting, and the January meeting will be looking at nature towns and cities, and again including some housing within that. So membership is open to anybody who would like to join us. Next slide, please. So this is the ask and the offer I mentioned at the start. So this is from UKHSA colleagues. If we click to the next slide, they have been undertaking a pilot study in London, looking at land surface temperature in prisons, looking at the impacts that sustained high temperatures and sustained low temperatures have on this population. If we go to the next slide, the reason why they've wanted to look at land surface temperature is that it's different to the ambient air temperature. So, for example, hot day at the weekend, you know, really quite warm outside, step out onto the patio, barefoot, burn your feet. As simple as that, but that does have impacts on health, well-being, and can make chronic conditions much worse for people who are living in those conditions. So what they found, and I don't think it was that surprising. It's linked to the quality of the estate and the build. Generally, the prisons in the summer are experiencing higher temperatures than the rest of the estate in London, and in the winter, it's generally colder. Next slide, please. So I'm almost, I think I've actually merged two slide contents there in my opening, in my discussion of that previous slide. So next slide. So the work is still in development. I think this might need another click. I'm sorry, I hadn't clocked this as a faffy slide. Oh no, we're all right. So it's work that's in development. And it is around trying to understand what the impacts and what the adaptations need to be for the prison estate. Next slide. This is where we get to the actual ask. Our UKHSA data colleagues are really, really interested in working on a defined geographical area with anybody from the social care sector who would like to explore what the application for this is to care homes. So we know that a lot of the care home estate, you know, some of the big providers have some wonderful facilities that are adapted for climate change. But we also know that a lot of the estate is dealing with Victorian buildings. There's less opportunity for adaptation. But if anybody would be interested in collaborating with UKHSA on this piece of work, please do drop me a line and I can do some introductions for you to find out more about that. And I think that could be bringing me to my last slide. So thank you for listening. Helen, I don't know if you want to save the comments or questions for the stakeholder panel.
Yeah. Thanks so much, Fiona. That was really useful and insightful. And can we just maybe offline just explore the care home request?
Definitely.
Because we've got two big Northwest commissioners group that do a lot of commissioning around home care and care homes. So there may be some opportunities to engage with our commissioners around this and might be interested in there. So we can certainly help facilitate that. So that's an offer from us. And then if there are other colleagues who want to get in touch, if you can put your name in the chat, we can pick that up with Fiona as well at the end. So that's great. Brilliant. So thanks so much for that. And I think now we're on to Tom. Can I bring you in, Tom, for you to do your slides? And you're right, we are saving questions for panel discussion at the end. So, Tom,
Yes,
I don't know who, I can't see your slides at the moment, so I don't know if somebody else is just putting them up.
I can see them.
So.
Yeah,
I can see them.
yeah.
Yeah.
Right. Go for it.
So again, for people who've joined late, I'm Tom Smart. I'm from Natural England, and I'm a senior officer in the Cheshire Lancashire area team. And I work on local nature recovery strategies in Liverpool, if people may have heard of them, and also a Bollin to Mersey nature recovery partnership, which is in the sort of south Greater Manchester and North Cheshire area. And that project has a lot of different sort of aims around sort of nature recovery, creating sort of more resilient landscapes and communities, and also a key element of it is connecting people with nature. So we support some small projects which are intended to be like little bits of research or pump prime sort of funding to test out different approaches that might work and be scalable and repeatable elsewhere. So while they are kind of constrained to that geography of sort of North Cheshire, South Greater Manchester, there's a lot of application, I think, of the case studies that I'll go through later. So hopefully they'll be of interest to people all over the Northwest. So next slide, please, Isha. Thank you. So yeah, so just what I'm going to cover today. I'll go a little bit into the implications of climate change for society, but for health and social care settings in particular. I'll then cover a bit of mitigation, adaptation, but I know that Fiona's sort of touched on that already. So I'll try and focus a bit more on the nature-based solutions. So there's lots of mitigation and adaptation that can be done using sort of what you might call hard infrastructure or sort of built solutions, but there's also ways that we can maximise the benefits of nature of these, and particularly in a health and social care setting. I'll talk about 3 case studies from that Nature Recovery Partnership in the Bollington Mersey. So one of these is trialling blue infrastructure or SUD scheme. So this is a sustainable drainage to reduce flood risk, which is obviously related to climate change, in an adult care facility, and also trying to upskill the staff members to be able to build nature into their care sort of programs. One looking at creating accessible green spaces for within Shore Hospital, based on some research that we've done alongside partners on what the hospital community, including staff, patients, visitors, want to see from their green spaces, and then using that to sort of kickstart a program of green space creation at the hospital. And finally, one that's a bit more out in the community, which is looking at how we can use green spaces to overcome sort of inequalities in social and health and well-being in some more deprived areas of South Manchester, and particularly with a focus on children, young people and families. And with each of those, I'll try and pick out a couple of practical sort of lessons learned, and then finally give some sort of idea of what the sort of how we can sort of pull all of that together into some overarching take-home messages. Next slide, please. So this is just a figure from the World Economic Forum Global Risks Perception Survey. So this is a survey of members of the Economic Forum, so some bigwigs, and then doing a horizon scan of what they think is the main sort of threats to society in the near term, in 2 years. And you can see there's a real mix of sort of economic and geopolitical and societal risks there. But in the longer time frame of 10 years, that becomes dominated by environmental risks, in particular things related to climate change in terms of extreme weather, natural resources, and changing to Earth systems, which is obviously very, very relevant to the topic today. Next slide, please. So what does that mean for health? Well, there is, of course, a combination of different direct and indirect risks. So there's a direct impacts of extreme weather, those sort of heat waves, extended cold snaps, which can impact vulnerable members of society, and also flood risks, of course. And then there's the resilience of our system, so our food supply, our energy supplies, and what that can mean for sort of healthcare and the well-being of our societies in particular, but also things like infrastructure. And if you remember back to a couple of years ago when we had the 40-degree heat and train lines were melting and motorways were sort of the tarmac was melting, and what might that mean if that becomes a regular occurrence for sectors that really rely on those supply chains, like the healthcare sector, which needs that sort of cold supply chain. And obviously that has lots of implications for our society, and these are exacerbated by inequalities in things like housing, and impacts on our sort of individual and collective productivity, which and our economy really. So again, in a sort of when we're dealing with adult health and social care settings, as Fiona I think mentioned, we're dealing with individuals which are really sensitive to these risks. They have not much adaptive capacity relative to the average people. So it's going to be a really acute to those people who use these services, exacerbating comorbidities and increasing the costs fundamentally to deliver the services that the health providers already do. And obviously that's a massive thing that came up in those word clouds around funding, for example. And just on the right, this figure is looking at the risks and under what time frame. And you can see that flooding and risk to health directly is really top of the adaptation subcommittee for climate change risk for the UK. Next slide, please. So this it's just to sort of, again, go over, I won't go into it in detail, but just how the sort of physics of climate change at the top with CO2 rise falls down into the meteorology, so I can't say that word, and then into those sort of interconnected impacts on our sort of our Earth systems, and then into the impacts on health. So you can imagine the top being the disease and the bottom being the symptoms, and everywhere in between is those sort of mechanisms of how that disease, so to speak, impacts on a person and on a society. So next slide, please. So climate change and mitigation, I won't go over this in detail. Broadly, mitigation is avoiding and reducing emissions, so preventing climate change from happening in the start, and adaptation is changing our behaviour or the way our systems work to protect ourselves of what's coming down the track at us. The important thing is the more mitigation that we do, the less adaptation we will need to do. And also adaptation and mitigation measures can be interconnected. And particularly you'll notice that in those two short lists, nature-based solutions apply to both. So nature can be used to both mitigate climate change and also help us adapt to the climate change that's already happening. So if you just click it again, Isha, sorry. So just an example, the mitigation of the solar panels over a car park to reduce our fossil fuels energies, and then this tidal flood defence building, which is going to be introduced in Somerset, is a sort of grey infrastructure, you might call it, a non-nature based solution to increasing sea levels and flood risk. Next slide, please. But what can nature do to help with this? So nature-based solutions, or NBS as they're often referred to, is taking advantage of the mitigation and adaptation capabilities that providing nature can actually, the ecosystem services they're often called, that nature can provide to help with reducing flood risk. So this quite stark example of urban street trees, which obviously has a mitigation impact in terms of it sucks carbon out of the atmosphere, improves our air quality, but it also provides adaptation in terms of shading and then cooling that ground surface temperatures. So if you imagine the prisons example from before, not many trees generally in the prison estate, that's why they're probably likely to be hotter than the average. And these can be really, really beneficial, not just at a local level, but really globally if they're scaled up. So they could, the IUCN, International Union for the Conservation of Nature, estimates that these could provide 30% of the amount of mitigation we would need to meet the Paris climate targets. It could reduce global emissions by 1 billion tonnes of CO2 per year. and it could save the world $393 billion by 2050 if we did it as optimally as possible. So big numbers. Next slide, please. So what does this mean in a sort of health and social care setting? So in terms of the mitigation and adaptation to climate change, but we can use the hospital health or adult social care state to create these natural carbon sinks. So if you think a little woodland or a small wetland or something on the estate, increasing the biodiversity of the site, sucking up carbon, but also creating this sort of natural aesthetic value that people enjoy. And then that will similarly reduce temperatures, improve air quality, as well as managing flood risk onto the site itself. So through doing that, you're not just mitigating and adapting to climate change, but creating these sort of what's been called like healing environments of physical and mental health benefits. There was a study way back in the 80s around taking thousands of patient records from 2 wards, which are essentially identical over many years, a really big data set, and found that one that sort of overlooked onto a sort of brick wall had much longer sort of healing and recuperation times than a similar ward which overlooked onto a green space around the hospital. So there are actual practical data behind this. It's not just a nice to have. It obviously can improve our mental and physical state of our staff and their productivity, which is important for health, but also economy more widely, and can improve preventative health through things like green social prescribing. Next slide, please. Again, these slides will be shared, so don't need to go into this in detail, but this is just to sort of show the interconnectedness and the different pathways between different sort of climate mitigations and the health impacts. So things like active travel, how that can improve community health and well-being, reducing needs for the hospital treatment in the first place, and then the design of our buildings to reduce CO2 emission, and also things like integrating natural and semi-natural areas into the estates themselves to do both that mitigation and that adaptation while also providing health and social benefits at the same time. Next slide, please. So moving on now to the case studies themselves. So this first one was co-designing nature-based solutions at an adult social care facility in Stockport. So this was through the Bollington Mersey Nature Recovery Partnership, as I say, and it was a partnership between Natural England, the Cheshire Wildlife Trust, and Opportunities Together, which is a branch of Stockport Borough Council. And there was sort of 2 strands to this. One of the main strands initially was research and sessions conducted by Cheshire Wildlife Trust to train and upskill the staff within the social care facility to, as I said, build nature programs, nature sort of sessions into their programs, and understanding how they can use nature-based activities to improve the livelihoods and the well-being of the service users. So there's things based on, you know, lots of growing and sowing, sessions on how they can understand how nature interconnects with health and mental and physical well-being, using nature for storytelling sessions, and also how it supports local wildlife. So lots of really sort of positive activities that not only can be used within this one social care setting, but can potentially, as staff move on and in changing their career, can be brought to bear in different sites. Next slide, please. So the other element of this, which has more of the climate change sort of bent to it, more explicitly, was using these sessions, and after we've built up these skills and relationships with the staff, was to design what's called a SUD scheme, a sustainable drainage scheme, on the grounds of the social care facility itself. So this is an example of how of climate change adaptation using a nature-based solution. So in the end, it was we produced a sort of what's called like a rain garden, which takes the rainfall in essentially peak rainfall off the roof through this drainage system and down through a this sort of pod, which collects the rainwater, slows it down, and filters it. So not only does this reduce the speed and the volume of the water entering the drainage system itself to reduce those sort of flash flooding risks for the facility, but it also provides those opportunities for more growing and sowing and sensory activities, which obviously link in with the sessions that were done before. Now, one of the challenges that we faced with this project was kind of unforeseen. Originally, the plans were quite ambitious for a sort of open water pond area with some seating, and this was really, really well supported by the facility staff. But it turns out that there was actually a tenancy agreement on the land, and there was specific requirements of the NHS. So the NHS was the landowner, and there was existing management agreements that were all very complicated that we're going to, that sort of limited what we were able to do. So it just showed the importance of engaging with all sort of stakeholders really early in the process. Next slide, please. So the sort of lessons from this one was, as I say, involving everyone really early in the co-design process. So there's potentially lots of things that, particularly if you're a organisation working in a new area like Cheshire Wildlife Trust in this area, for example, there's unexpected issues around that sort of tenancy agreement, and also the different levels of risk assessments that may be required, which perhaps people on this call are well aware of, but maybe others aren't, and that would work in a vice versa as well. It was important that the training had to be really gradual and really clear. It was quite evident that the care facility staff were much more comfortable with the growing and sowing than sort of wetland and flood risk elements, which seemed a bit more technical and potentially a bit more intimidating to them. But linked to that, the building of partnerships takes time, and it's there was lots of further opportunities if the project had a great scope. So the local school really wanted to be involved, but because of term time and everything and their curriculum constraints, they weren't able to join the project at the time. But this is an example that they can then adapt and bring into their school estate later. And also, it's really important that we had buy-in from the senior leadership of the care facility. We had this really keen site manager who was really important in pushing the project forward. That may not be possible everywhere, so it's important to find those people where they are. Next slide, please. So the next project was between Natural England, Manchester Foundation Trust in Wythenshawe Hospital, and a local NGO, So the City. And this was a project studying staff and visitor and patient attitudes to green spaces and their wishes and what they wanted to see from their green spaces and what are the barriers to them using them more. And then we used the results of this sort of survey to design a accessible green space in Bagley Woodland, which is a small patch of sort of really dense forest, which is now, through using corporate social responsibility days, has now been opened up. There's now the beginnings of a path, a nice loop which can be enhanced into a green space to be used by patients and staff, and in a care setting as well. So this is also important in that would become the first step in what's been called the Sawyer's Saunter, in memory of a late radiologist, Richard Sawyer, who was really, really keen on enhancing the green spaces around this hospital. And the eventual ambition is to create a continuous loop around the entire hospital estate of these accessible green spaces. Next slide, please. So this is quite clearly a nature-based solution for both climate and health. It provides that climate mitigation through obvious reasons by improving the condition of the woodland. There's great carbon sequestration, improved air quality. It provides adaptation, a cool shaded area that people can use in times of extreme heat. And there's also masses of opportunities for mental health and well-being of all members of the staff community, and that really came through in the surveys. Also opportunities for using practically within therapies, particularly physiotherapy, occupational health, and outdoor treatments in that sort of healing environment that I mentioned before. So one of the quite senior anaesthetist was talking about how it could be used potentially for long-term oncology. People can take their chemotherapy outdoors on nice days if there can be power installed outside, and things like dialysis treatments as well that just make it a bit more of a nice environment. Next slide, please. I realise I'm running short on time. So the take-home message of this was that really strong majority of the staff strongly agreed that these spaces were important, but less of them used it. Less than half actually used them. And the barriers to this were a lack of knowledge, including where the spaces were, lack of time, which we've seen, inclement weather, and also poor perceptions of the quality of the green spaces. So by enhancing them, we can close that gap, and particularly if we co-design it with the community. And again, they had the importance of individual buy-in. So this is we were sort of taking an existing idea that was organic from the hospital community themselves of the Soy Saunter, and looking at how we can sort of support that and take it to the next stage, really. Next slide, please. This last one I'll go through quite quickly. So this is overcoming barriers to green space for young people in South Manchester. It was a collaboration with the Integrated Care Board and another NGO, Be Well, as well as support from So the City. And it looked at the barriers to young people engaging with their local green spaces in these more deprived areas of South Manchester. And Be Well ran a series of surveys with young people, structured interviews with professionals working in the community, like in pupil referral units. And also they ran practical taster sessions, which you could see here, there was 4 of them doing different activities in the green spaces to get people to try and see what's possible in the green spaces, and using it as a NBS for poor health and well-being. So next slide, please. So key barriers that the surveys identified was perceived danger in some of these spaces. Some respondents were fearful that they'd be profiled by police if they were seen to be loitering in the green spaces, and also importantly, lack of organised activities to do there, which potentially gives a role for social prescribing for healthcare out in the community. If the results were really positive, the taster sessions improved these wellbeing scores. I won't pretend to know what WWBS stands for, but there were some really stark results there from the sort of before and after study. And interestingly, one of the participants reported feeling physically cooler, because she said that when she was very stressed and anxious, or she was having a panic attack, the symptoms would be about feeling of heat, which obviously in periods of extreme heat, if you don't have lots of accessible green spaces, that could be exacerbated. So using those green spaces could actually help with the symptoms of her mental well-being issues. And the key learning from that was to meet young people where they are. They wanted to integrate with the school curricula in local schools. One of the pieces of feedback was by the time they're out of school, there's not much time for them to do things. So if we can integrate these into the curriculum, can be really, really beneficial. Next slide, please. So just a summary and roundup. As I mentioned, identify those open doors where there are really keen individuals, because different personalities are so important with these partnership projects. They require patience and resources. building trust and knowledge and confidence really among the stakeholders, and also to involve all the relevant stakeholders from the get-go. Importantly, it's not everything goes well, and that's fine. So in terms of disseminating the findings, it's important to spread those lessons learned and what didn't go to plan, and that can be spread to different partners. And also that these sort of new cross-sectoral partnerships can be really good for future opportunities, as I mentioned with the rain garden, how that can spread to the local educational estate as well. So sorry, that was a little bit of a whistle stop at the end, but yeah, that's all from me. I do have one extra slide just to leave people thinking before the questions. If you just go to the next slide. Just around our natural health service. So maybe for something for the discussion later around how can we, everyone in this call, build a sort of natural health service which has been supported by, in Scotland in particular, by Nature Scot and the Scottish Healthcare Board. Thank you very much.
Thanks, Tom. That was brilliant. I really liked that. You know, you went big scale, didn't you, on some of the sort of examples of what's happening, and then went down to like some really easy stuff that people can do to really help the climate. So that was brilliant, and hopefully we'll pick up some of conversation and questions in the panel meeting. So we're on the last presentation, folks. So Lindy, can I hand over to you from a Wigan's perspective on all the work that you've been doing locally?
Thanks, Helen. Morning, everyone. So I've been asked to come along and talk about our remodelling and redesign of our home care market and the benefits that this has led to on the environment. So you might be thinking, what's a commissioning journey got to do with climate change? But please bear with me. Next slide, please. And again. So I just want to set the scene a little bit, because I don't know how familiar you might be with the Wigan Borough, but we're a big place. So we currently serve 329,000 residents, and our borough does cover an area of 77 square miles, and we're the 9th largest metropolitan authority in England. So in order to navigate around delivering home care is quite a challenge. We're made up of 14 proud and distinct neighbourhoods, and they all have their own quirks and personalities in each of those neighbourhoods as well. We've got a rich industrial heritage and have been known as mill and mining towns. We've done textile production, cotton mills, coal mining through the years. And much of the impact of that heritage actually has shaped our environment. So we've got quite a large developed green spaces. We've got the Pennington and Wigan Flashes, which are our local nature reserves, and a bit of a water sports haven over at Wigan Flashes at the moment. Next slide, please. So our approach in Wigan has always been to do things differently. So this is where our journey sort of began. Back in 2013, when austerity hit, we had to have a look at how we could meet challenges of cutting the budgets, but obviously having minimal impact on our adult social care provision. And as a council, we looked to develop the deal. So people may have heard about the Wigan deal, which was that contractual relationship with our citizens in terms of, as communities, what could they do in terms of that reciprocal relationship? What was our part and what was their part to be able to jointly meet the challenges? And this approach really was born out of the work that we'd done in adult social care in developing our asset-based approach, which was a single unifying philosophy really about how we connect to people and the place, and really understand what that means for people living in the environments and communities that they live in. So in commissioning, we started to look at our service provision as well, ensure that these were fit for the future, providing high quality, sustainable support that was affordable for us as a council. And we didn't simply want to cut services, but radically redesign what we were delivering. Next slide, please. So our asset-based approach sort of considered the whole person and focused on building good health and well-being, and not just looking at meeting needs. And we developed our 5-point formula around this. So looking at our values and attitudes of the workforce, giving staff the tools and training to have those asset-based conversations and about really seeing the whole person in front of you, and their experiences, their history, their family networks, the where they live. Ensuring that the people that we supported felt connected with the communities and they were active contributors, using the local shops, community activities, getting out into the parks and using our leisure centres and libraries. Giving staff permission to do things differently and encouraging them to be creative, understanding what would make a real difference to a person's life and taking some positive risks around that, and really embedding that neighbourhood working on a granular level, getting to know the area, who you're working alongside, sharing your resources, and taking that one team approach to helping people. Next slide, please. So how did we apply that to the home care market? So this was back in 2015. Our market looked very different. So this is the map that we had with all our providers on it. We had over 30 providers delivering across the whole 77 square mile. And you can see on the map, you know, range different colours, which each represents a provider. So we might have had 3, 4, 5 providers working in the same street. There was no real structure or strategy to how we commissioned it. So providers and carers were travelling the length and breadth of our very large borough that I've described on a daily basis. They were spending more time travelling than they were caring, and found it really hard to get to know the people in the places that they were living in. Care was very time and task orientated. We had lots of 15-minute calls, and people that were supported commented to us about feeling rushed or carers not having the time to really get to know them. And all our providers were struggling to recruit and retain staff. There was a high use of 0 hours contracts and no consistency around payment for travel time and reward and recognition of carers as valued members of the workforce. Next slide, please. So what did we do? So we worked with our providers and co-produced, really understanding what they needed from us to make it financially viable and sustainable for them as a business. So we as a result, we agreed to let each tender lot with at least 1,000 commissioned hours as a minimum. We went old school and sat down with maps of the borough and marker pens with the providers to draw out the routes carers could take. As I mentioned earlier, our industrial heritage also includes a number of waterways. We've got the Leeds-Liverpool Canal and the Bridgewater Canal running across the borough. So if we'd have sat down as a council and just, you know, looked at a purely arbitrary geographical split, that could mean carers are having to traverse further to cut across the canal networks. So we really sat down with our providers as the experts and made neighbourhood zones that really made sense to a home care delivery model. And we wanted providers to work as a whole network of home care. So wanted to change that dynamic around providers and not being in competition with each other. So we fixed on a fixed cost for the home care delivery in Wigan. But again, we modelled that with our providers to make sure it was a rate that was sustainable for them and affordable to us using that open book accounting approach. And we wanted to move beyond social value in our tender process. So we call it community wealth building, keeping the Wigan pound around and testing out what they could deliver and give back in terms of an organisation, especially to our most deprived areas and people not in education, employment or training. Next slide, please. So this is our maps now. So as you can see, it looks very different. This is the pictures before and after. So providers we've got now, we have 8 providers who deliver in a place-based way across the 18 neighbourhood zones. And providers and frontline care staff really have the opportunity now to get to know the people and the places that they live in and helping them to connect with the local communities and bringing people together. And the change to neighbourhood working, as I said, has significantly improved our impact on climate change. Next slide, please. So the main impact environmentally that we've seen has been the shift of travel for carers. According to UK Department of Transport, obviously 27% of countries' total greenhouse gas emissions. Cars are the biggest contributors to that. And home care workers across the UK are estimated to travel more than 4 million miles per day, and each worker can travel an average of 2.9 miles per home care visit in a day. So it's a massive impact of having those cars on the road. So with working in the neighbourhood model, our providers really maximising now on local recruitment, and we've got 86% of our workforce now live in the place where they actually deliver care. So even just travelling into work or travelling to the office for training, picking up equipment, PPE, etc., that can be done. You know, they can walk to the office and not need to jump in the car. And providers are working, providing active transport. So obviously not only benefits the environment, but also the health and wellbeing amongst our care teams. And 45% of our home care delivery is now done via walking and cycling routes. So reducing the amount of cars on the road, reducing that travel time and the reliance on needing a car. So we've estimated this is taking around 7,000 miles of car travel a day off our borough roads amongst our home care providers, so massively reducing their impact on air pollution. And it's opened up job opportunities for people who don't drive and can't afford to run a car, so including lots of younger people. So traditionally home cares are, middle-aged women deliver home care, and we've actually seen a shift in that now. So 25% of our workforce is under 25, so we're getting younger people into that workforce. And obviously it's reduced our carbon footprint impact, reducing the travel time and mileage, and that's down to 50% of the national benchmarking. And in terms of reliability, they're less likely to be delayed due to traffic hold-ups or bad weather, which I'll expand on further. Next slide, please. So I just dropped this in. I'm not going to read it out. You can have a read of it when you get the slides. But this is a quote from one of our biggest providers in Wigan. So we do have providers who cover a couple of different areas, and they provide the free pool bikes for staff to get around. So really encouraging, the use of bikes rather than cars. Next slide, please. We've also looked at how we deliver the care, and does it have to be an in-person visit? So we've now expanded to offer virtual home care visits as well. And we've seen real successes in this in terms of utilising the offer for people who don't necessarily want or need a traditional in-person call. Some people weren't engaging in support because they didn't want people to come into their homes or see people, delivering care actually in the home. So it's been improved outcomes for people who were disengaging with that face-to-face support, and they can have a phone call or a video call on their own phones, and enabling a much more flexible support option for people. And obviously with the virtual calls, we've taken that travel aspect out altogether. So we've estimated that around 7,500 hours of travel time has been taken out a year, and that works out on an average about 200 miles a day that people are not having to travel because we do that virtual offer. Next slide, please. So I mentioned about extreme weather events. So we currently deliver 21,000 hours of home care across, and that hyper-local delivery is ensured that providers can successfully respond to any adverse weather events. And we had recent experience of this. We had widespread flooding across the borough in January, actually on New Year's Day. So we had a number of major road closures, closed to traffic. Homes in some areas of Wigan were without power for much of New Year's Day and the days following, following heavy rain and snow. And it was declared a major incident by Greater Manchester Police. But despite all the odds against them, our providers were able to mobilise our staff in those local patches, maximising the effectiveness of the walking routes to get carers out into people's homes, and all essential support was delivered. Carers work with our local civil contingencies team out on the streets to find safe routes through the water to get to those most vulnerable people, deliver care, and also provided some essential supplies, including meals, to those that were without power. And they were also able to support the police and fire crews to identify where there were people who would need assistance to evacuate in the worst affected areas. So working with the allocated provider in each of those areas enabled that information to be gathered really quickly. So they're not talking to 30 providers. So it really helped to support that emergency response, and it was a real community effort to minimise the effect on those people with the most complex health and social care needs, and get support and help out to them as soon as possible. Next slide, please. So through this one in, it's nothing to do with climate change, it's just what we love to do in terms of celebrating our relationship with our providers, and we do really see them as part of our wider workforce, and they're always going above and beyond. So it's just some lovely pictures of our carers doing stuff out in the community, charity fundraising, raising awareness, organising events and parties for their customers, and really recognising the carers who go above and beyond in their role. So they've really embodied our shared vision and work as a care network, and they themselves share resources, training, advice. Next slide, please. So as I mentioned about our community wealth ambition in Wigan, so we spend a huge amount of money on adult social care, but with choosing the right partners, that then translates to a huge investment in local businesses, local jobs and money that's then reinvested back into Wigan. So not only benefiting our economy, but also our environment. And we've looked at how we use our influence as anchor institutions to maximise that investment in the area. One of the areas we've focused on as a council is growing our own in terms of the careers that are needed for the future. So in Wigan, our three main market areas are health and social care, construction and manufacturing. So we've recently signed a civic university agreement between the council, Wigan and Lee College, Edge Hill University and Wrightington, Wigan and Lee teaching hospitals to develop career pathways in each of these markets. And some of that is around green technology careers. So really like investing in our younger people and keeping them working and supporting us in Wigan. Next slide, please. So next steps as a council. So we're moving away from the deal now, and we're evolving our approach and focusing it more on the progress with Unity. So again, it's really about communities framed by two simple missions and our 6 ways of working to ensure we're focusing on improving the lives of our citizens and communities in a truly inclusive way. And we continue to look at how the wider determinants of health impact on all our communities. So following on from the success of the home care remodelling, we shared the learning to influence market shaping of our supported living market, and living in really good quality homes and being economically stable are 2 of the foundation building blocks to good health. So we've expanded our supported living offer significantly over the last 10 years, working with developers on building really good quality accommodation and bespoke housing. But over the last 5 years, we've really focused on working with them in terms of the new builds to be more energy efficient. So our most recent builds for supported living and extra care living, we've maximised on energy efficient heating using heat source pumps. So they're helping us to move towards our carbon neutral goals and also make running costs for customers easier to manage as well. Making sure our buildings are sustainable and work as effective as possible. So we're installing assistive tech and smart tech in our buildings at the outset rather than retrofitting those later down the line. And Tom's presentations just reminded me actually that we've retained woodland areas within some of our recent developments as well. So extra care for older peoples over in Shevington that's just opened last few months. And one of our specialist supported living services for people with learning disabilities and autism. We retained woodland areas in both of those developments and actually have woodland walks in those, so really benefit the people that are living there and the tenants that use them. Next slide, please. So this is just our 6 ways of working. So I'm not going to go into any great detail on this, but this is, again, that shift change in developing a culture across the whole of the council and with our anchor partners. So we're looking at how we can operate as a unified system across all our organisations working in Wigan. And these ways of working will just further embed the neighbourhood model and enable further initiatives with our providers who are really committed to the people that they work with and Wigan as a place. Next slide, please. So summing up, so thinking about how we commissioned our care has helped us get to that position now where services are affordable for us and sustainable for the people that we support and our providers. There's obviously been the significant impact in terms of the added benefits in the reduction of travel time and the reliance on cars, which ultimately benefits the environment and reducing our carbon footprint. We've got mature and trusted relationships now with our providers, and constantly work with them to develop and improve quality. And we can evidence the quality of the support, and we regularly speak to our customers about their care and support, ensuring it's working for them and is delivering care, and is delivered by caring and compassionate staff who know them well and feel really connected to the communities. So working on co-producing solutions together has enabled us to provide really great quality services, and obviously seeing the wider benefits to the community and our environment. And that's me done, I think. So thank you for listening.
Lindy, thanks so much for that presentation. Absolutely fantastic. And I just want to thank all three speakers and the for your presentations. Absolutely brilliant. And I think what we can see, it demonstrates what great work is going on across the region to try and tackle climate change, and what a pivotal role the public sector plays in trying to do that. So that's absolutely brilliant. We're sort of more or less bang on time, and we did agree that we're going to just have a short comfort break of about 10 minutes. But in that 10 minutes, colleagues that are on the call, it'd be really great if you started posting some questions, because we're going to come back and regroup for a panel discussion with all three presenters, and we're hoping to get some really great conversations going with colleagues on the call about what you're doing in your own area within your own organisation, and sort of sharing some of the learning from yourself, but also asking the panel for some insights from them, from their own perspective as well. So if we come back at about 3 minutes past 11, that would be really, really helpful. And if you could start posting some questions in there, that would be brilliant. And I'll pick up the conversation with everybody and try and facilitate a really good discussion about 3 minutes past 11. Is that okay with everyone? So most people just switch off cameras and mute mics as well for that period of time. So bear with us as we have a little short break. Three of you here, and I'm really pleased to say our audience have started posting some questions in the chat and some reflections as well about their own sort of work as well. So I'm going to start at the top, and the first question that I can see is from Charlie. And the question is, how can we build up public interest and excitement in environmental projects? So I'm going to start with you, Tom. What's your thinking about that? Oh, sorry, Fiona, did you want to come in first?
Well, I'd already been reading the question, so Tom, to give you a bit of a thinking space, if that's all right.
Absolutely.
To all three of you, but if you start with you then, Fiona.
Yeah, I thought that was a cracking question from Charlie. There was a report published a week or two ago that was saying that actually there's more public support for climate and nature action than we think. We do think it's much, much lower, but I think a lot of, or what the report was saying, people who are passionate about climate change or vaguely interested in climate change, you don't have to be passionate about it. You might just be interested and want to do something. But we tend to underestimate how interested other people are in it. So we don't say much about it, and we don't talk much about it. So if I can find the link for this report, I'll put it in the chat. But it was basically saying that public support for climate action is much higher than is actually believed. And I think to answer your question, it's about creating that space where people feel able to talk about it.
Yeah. I mean, I think what we've talked about here today with some of your really great examples, it's really small things that make a really big difference, isn't it? And actually, when people see like some really small things that don't really cost that much, having a really great impact, that I think that gives us hope, doesn't it? Because actually, when we hear a lot of the stuff on the media, it's all doom and gloom. It's almost like it's a catastrophe, and it does feel like that, doesn't it? Like there's nothing that we can do about it. But actually listening to you three, there's loads that we can do about it, and it gives us that hope. And I think that's the flip that we need to switch to, that there is hope and there are things that we can do, and this personal responsibility that we can take about doing those things. So that's what I got from your presentation. So Tom, I'll come to you. I don't know if you, with lots of nods when I said that.
Yeah, I fully agree. I think there's also a bit of a messaging issue around sort of climate and nature sort of activities, in that a lot of the debate seems to focus on the costs to the individual and to the society around the sort of really big picture, like how do we achieve net zero and all of these things. And there's very little sort of weight put on the sort of co-benefits of doing this. I think Fiona's absolutely right. Everyone, or the vast majority of the public, want climate action. However, if you then put that question and say, would you like an extra couple of pence on your income tax? They say, oh no. That's generally what comes out in the research. But I think that's because a lot of the sort of public perception around climate sort of action is all around cost, with not much sort of perceived benefit other than the very sort of abstract, well, there's a reduction in CO2 emissions, which doesn't really mean much to people's practical lives. But as I think we try to show in some of these sort of case studies, is that by doing some of the climate action, you can have real tangible impacts on individual communities' lives, and they can see it in their community. If you're there, local green space is enhanced for nature, and it also becomes more climate resilient and improves the risk of flooding. People see that in their daily lives. So there's the thing around talking about climate change and in terms of pollution, because that's sort of a tangible thing that people can see in their communities. And I think that's really, really strong. So I think if we can focus not just on the numbers and the 0.1 of a degree, and and talk more about what else is happening and what else is beneficial. And
practical solutions, I think.
Practical, that means something to people.
Yeah, absolutely. Lindy, what about your perspective?
Yeah, I think you just reiterate what everyone else has said in terms of making it really personal to people. Like you said, sometimes it seems too big for any one person to make that impact, but actually talking about, the local effect, and as Fiona said, sack the polar bears, let's start talking about bees and and nature. People are passionate about that, and that makes it makes sense to them. It's relatable, isn't it, rather than thinking, ice caps in how's that going to affect me. So I think, just reiterate what everyone else said around making it really palatable for people, really, in terms of what will happen to them locally, and making sure that they can do those small changes to make that real impact and difference.
Yeah. And there's a specific question to you, Lindy, in the chat, which was around, the magic that you did in Wigan about, so let me just get the actual word in. So how did you move from having so many providers to just 8 providers in terms of ongoing contracts? That must have been a challenge, actually.
Yeah, so in our first iteration, so we've been doing this for a few years now, we had 11 providers, but over time some of those have exited either through quality issues or have decided working in Wigan's not for them, and the model that we were operating on didn't work for some providers, some of our bigger national operators. So actually not necessarily by design, but certainly as we are now, all our 8 providers are local or regional providers. We don't have any what we would call big players, I guess. And that again is more of that community sort of feel to how we wanted to commission and provide home care in Wigan. But yeah, I've spoken to a few local authorities about how we've done this, and this question always comes up. And the answer really is it's not the easiest, but we went big bang. So all our contracts were expiring and we retendered everything. and shifted everything across in terms of TUPE transfers, etc., in one go. So it was disruptive, and it needed to be able to shift, because I think you can't really do it piecemeal. You can't do it by area, because although it was a challenge for providers to shift staff across and everything, it just wouldn't practically have worked. If you were only doing one area, then what do you do about your staff who were already working, the other side of the borough and things like that? So it was a challenge, and like I say, we worked very hard with our providers. Some of the smaller organisations didn't have much experience of TUPE, but we supported them with that, and some of our bigger organisations that had, again, shared their expertise and support around that as well. So yeah, it wasn't easy, but it was just a whole hog shifting across at the time, and that worked really well. We kept our customers updated throughout the whole process, let them know, periodically through the tender where we were up to in the stages, had regular contacts available for them within our quality performance officers within our team were available to talk through with customers if they were worried. But we described to them, more often than not, the person who walks through your front door won't change. They just might be wearing a different uniform. So that was some reassurance to them in terms of they probably wouldn't see much of a difference, because it's more in the back office who's like delivering that care. Doesn't really change, because we've TUPE'd those staff over. So and we didn't really have a lot of concerns or complaints or anything that sort of people were concerned about when that transfer did happen. So it was mammoth, but we got through it.
Thanks so much, Lindy. I've got a really long reflection comment from Mandy. I'm going to actually ask Mandy to come in and sort of pick up this issue about the new ICB blueprint model and sustainability. I don't know if Mandy's still on the call.
Hello, yes. I'm not going to.
Hi, Mandy.
Hello. I'm not going to put my camera on. My hair is terrifying.
Don't worry.
Today, so
don't worry. You ask your question.
Yeah. So obviously the NHS England is going, and we will be absorbed somewhere in the Department for Health. But obviously ICBs have been told to cut operational costs by 50%, as have trusts, and there's a new blueprint for ICBs which suggests that some functions should move out from ICBs to providers. Sustainability is one of those recommended functions. It's not yet been set in stone, but it's there as a recommendation, and I just feel that's a massive strategic misstep, really, to take it out of something that with the ICB having oversight of both primary and secondary care, and then it going into the providers who are also going to lose 50% of staff. So they're struggling already with sustainability roles in secondary care. There's not enough funding. I'm just seeing this doom-laden scenario. God, it sounds awful, but
yeah,
who's going to coordinate everything? That was the kind of my reflection. And
I'm going to come to Fiona in a bit on this one, just because I think Fiona will have a great sort of overview of things. And it's all this is very new, isn't it, at the moment?
Yes,
and there's a lot of unknowns. There's a lot of uncertainty, and I'm not sure we've got any sort of answer. We'll have any sort of answer around some of this, but it's great that you've raised it, and it is something that we need to be thinking about going forward. I don't know, Fiona, if you've got any reflections on what is happening with, I know you don't sit in the NHS, but you've got lots and lots of colleagues that you sort of connect with. What's your thoughts on this?
I think what we have is a situation with change and no actual plan and no strategic vision. And I think what we have is plans being pulled together in a piecemeal way, which is really frustrating and really, really challenging. We haven't got a full map of what the world is going to look like in the future. I share your concerns around, well, actually, I share the wider concerns about what that means for climate change action, not only for the ICB, but I do wonder, well, why was it all right to pick that as a topic to be moved out? There's a few topics I'm kind of thinking that about as well at the minute. I think it's kind of a watch this space and articulate these concerns wherever there is the opportunity to do so.
I don't know if that's, that's some reflections, Mandy. I don't think we've got all the answers and there's a lot of uncertainty, but things that we need to escalate.
I think, I think it, the message I take from it is that they are prioritizing sort of short-term financial gains over those long-term sort of resilience. And I think they're going to come undone.
Yeah. I mean, it's quite pertinent to Wigan and to a lot of councils, this actually, because obviously, Lindy, for you, austerity was one of those phases, wasn't it, where like there was major sort of cuts to local authority sort of funding, and you did something very different and actually went about it in a very sustainable way, and you're, I feel, reaping some of the rewards of that. I don't know if that's your reflections on it. I know this is health colleagues, but it's quite similar actually, isn't it?
It is, and like you say, it was very challenging, but actually, like you said, sometimes it does make you rethink and relook at what you're doing and why you're doing it, and now you're doing it in the best way. And really, all I can say is just working with our partners in community, co-producing that, how we move forward with that has been massive. And like I said, we started that back in 2013, and we're by no means, safe as a council, but we're not experiencing some of the financial challenges that other local authorities are, who might have been later along the journey to doing that. So I think, like you say, it was brave of us, I think, at the time to do that radical redesign and think about our relationships with our customers. But we are definitely seeing the benefits of that now.
Yeah, so a lot to learn from Wigan, I think. Right, I'm moving on because we've got quite a few questions. So we've got a question from Louise about how the panel members keep themselves positive, because obviously some of the stats that we've sort of presented today, it does feel a bit doom and gloom, doesn't it? And I suppose we sort of mentioned at the beginning trying to look at practical things, but any further reflections? I'm going to come to Tom first around how do you keep yourself positive, Tom?
Good question. Maybe not the best at it a lot of the time. I'm a bit of a news hound and got kind of so logging off is one that I should do more of, but don't do enough of.
Get into nature.
Getting into nature, literally, honestly, and yeah, just thinking about things that are happening in your local community. I think that is the major thing. I think people have alluded to massive political changes that happen on the other side of the ocean and what that means for this agenda. And that is so beyond our control that, you can't sort of take that on your shoulders. So think about what happens in your local community, get into your local spaces, put the phone down, and I mean, do as I say, not as I do, I think is a big one. And yeah, have that moment sort of to appreciate what successes there are of whatever size, because we can't control the sort of macro picture, but you can control what goes on in your own sort of environment.
Wise words. Thanks for that. What about you, Fiona?
I think it's celebrating the wins, because it can be tough working on this agenda, but events like this, the sharing of good practice, hearing what's happening in Wigan. Lindsay, I loved your presentation, and Tom, all the work you're doing. And there's examples popping up in the chat as well. As there's a seed library at Southport. That's made my day finding out about that. So it it's the small wins, and also there's an element of sheer bloody mindedness, because there is an element of, yeah, there's a lot I can't do, but there are things that I can do. So what will I take forward? And, you know, selfishly, for my decompression time, it's growing tomatoes and going for a walk in the trees. And then it's thinking about what I can do in work, promoting this agenda, pushing it forward. I mean, there's a couple of questions that are kind of related to this theme about trying to drive the agenda. And I was reflecting on this because the attendance for this meeting today is probably among the lowest of the masterclasses so far. And I think that shows the challenge we're up against with climate change. So I was thinking, well, how do we do this? How do we make it better? And the idea I have, having made myself a cup of tea, is maybe it's not about saying this is a meeting about the environment and climate change. Maybe it's about weaving climate change into every other meeting. So if you're going to talk about commissioning services, what would be the nature-based solution in there? If you're going to do a joint strategic needs assessment of housing and mental health in an area, where would be the nature-based solutions in there? So you kind of sneak it in by stealth, is what I'm thinking. I've always wanted to run a covert operations team.
Tom, you've got your hand up. Did you want to come back in?
Yeah, but Lindy wants to.
Do you want to go? Yeah, do you want your reflections first, Lindsay, and we'll go to Tom?
No, it's fine. I think I'd just probably repeat what everybody else has said. Like you say, I think it can't be a byproduct, can it? It does need to be interwoven into everything you're looking at, but it doesn't have to be that. That's the focus. Like you say, what can you weave into those plans and strategies?
One thing that occurred to me after I finished speaking was, when you're seeing sort of catastrophic headlines in a newspaper or something, they're not always the most representative of the science. Newspapers naturally will pick out ones which are particularly catastrophic, and then they will pick out the most catastrophic bit of the study and then look at the sort of upper, most extreme sort of potential result. And normally when you look at the paper, it's a very different vibe when you look at the paper itself. And equally, there is a bit of, sometimes scientists will like to have a big shock headline in their paper anyway.
Yeah.
So there's thousands of papers that get published every week on climate, and only one or two hit the headlines. Take that as you will.
Yeah. So there's a comment as well. It kind of links to some of this that we've been talking about. How it's around that perceptions, isn't it? About there's the perception that we need to fix nature rather than live alongside it. So Tom, I'm coming to you again, because obviously a lot of the work that you've been doing, you're trying to encourage some of that sort of living beside nature, or getting nature sort of what's your sort of reflections on that question?
We had a little bit of a sort of chat offline before when we were just setting up around things like people wanting to always chop down trees and as soon as they broached into their garden or something. And I think from experience, when we've had projects working with like local councils or whatever, and when they've wanted to leave sort of a bit more wild growth on their verges and things, and they get lots of complaints from from residents around, well, this looks messy, why hasn't the council come around and done things? But then if you pre-warn, so to speak, the public around what you're doing and why, and if you say this, we're creating a wild area for bees and pollinators, everyone loves it. But if they just see
flipping the story a bit, this isn't it, and trying to flip it on its head and say, actually, this is it's great for our nature for us to be doing that. People start to think a bit differently, don't they?
It's just a bit of comms ahead of time often does wonders.
Yeah. Right, I've got a question. I'm going to bring Sarah in if she's still on the call, because she's got an observation. Sarah, are you there? Do you want me?
Is it about the vocational training?
Yeah, that's the one.
Hello.
Hi, Sarah.
There I am. Yes.
Oh, we can see you. That's great.
Yeah. So yeah, I'm just moving out of further education. I'm sustainability lead for a further education college and going to Salford Council at the beginning of June as the low carbon business. Yeah, so I'm going to be low carbon business engagement officer. So I'm looking forward to officer manager. So I'm going to be looking forward to that. And in FE in vocational, we do see quite a lack of environmental education. I think a lot of studies come from the university sector where students are a lot more informed, but in vocational qualifications, there's a massive gap, and that's come from secondary school and that lack of education coming from secondary school. I think primary schools get a lot of environmental education, but because of concentrating on GCSEs, it just goes by the wayside. And if you do geography, you might get a unit on climate change, but that's about it. And I know, Fiona, you were saying that there's the climate ambassadors and the DFE climate strategy, which is not quite statutory, but it's not in Ofsted. Ofsted don't look at it and rarely look at it. They might pick up areas of best practice, but it's not a criteria that colleges prioritise when Ofsted's coming in, and the qualifications as well. So particularly I was thinking about the nursing qualifications and healthcare qualifications, adult social care qualifications. Is climate change a criteria in that? And how is it measured? So that was my observation.
Any reflections from panel that want to come in?
I'll let Claire go, but I've just put a link in the chat.
Don't know if that's in relation to this.
It was just something that I picked up on,
yeah.
and I haven't investigated it any further. But I was speaking to somebody. I'm from the Rural University Teaching Hospitals, and I was speaking to one of our local charities, and they've been working with Chester University, and they do a course for nature-based training for the nurse students at Chester, and that's been really well received. So it's something that I'm looking into for our existing nurses, so not the students, to see if there's some of these courses we can do. And it's about getting them out in nature for a couple of days courses so that they understand, kind of like forest school but for adults, and to get them learning about nature and the environment and how that can help their patients to hopefully grow the knowledge amongst that workforce. So I will share it. Obviously, I'll share it with Mandy because I'm quite close to Mandy with the Cheshire and Mersey Sustainability Board. Once I find out more information, then she can share that wider, because I thought that was really interesting and something that I think would be great to grow the learning of our workforce, especially our nursing teams.
That's really good.
Excellent. Any other reflections from panel?
Just on the point around secondary education, there is going to be, I did hear about the natural history GCSE a couple of years ago, and I was just wondering where it's up to, so I just Googled it. I put it in the chat, and it's OCR would be delivering it, and just a couple of months ago, 2 months ago today, on their website, we're thrilled to announce that as of today, the DFE has confirmed plans to move ahead with the GCSE Natural History qualification in a parliamentary question. So one of the first new GCSEs introduced over a decade. So that's, hopefully, I can imagine that could be quite popular, and be able to build that sort of nature-based education into secondary. Because you're right, I think a lot of kids at primary school get out and have little day trips and stuff, and they build nature into the curriculum, but it does sort of fall off at secondary. So maybe that gap is hopefully going to be bridged in the coming years.
Do you know what I saw on the did anybody watch Simon Reeve's Scandinavia this week at all? I'm a big fan of Simon Reeves, but he went to a place, I think it was in Norway, where the school, even at minus 18 degrees, all the kids are outside learning, are in nature. It's almost embedded in everything they do, and they've got a big philosophy about in the Scandi countries about being outside and being in nature, and they're really precious about saving their environment, aren't they? But it was a fascinating watch, seeing all these like little 5-year-olds all wrapped up. There's about 20 of them just going into the forest, playing in the snow, and they've got much more of a risk of they're not really risk averse at all, the parents, because I think in this country most people would like, oh well, our kids aren't going out, are not going to go out into the cold air in winter. It was just fascinating, the different cultural perspective on getting the kids very early on in nature, understanding nature and being in that environment. It was brilliant, well worth a watch. Right, sorry, I'm rambling on, and I've noticed that both Fiona's been answering a lot of questions in the chat, and I think Tom has. Is there anything, Fiona, that you want to pick up in the chat at all, because we are getting close to the end of session, so I'm just wondering if we can start to pick up and summarize some of the sort of conversations that have been happening.
Okay, I was just typing an answer to Charlie about planting more trees, which I will just click send on. And there was something I saw just coming up at this. So coming at this from a climate team perspective, do you have any advice on how we can engage and support our colleagues in public health, adults and children's social care? And that's from Liz Atherton. I would say that with most public health teams, you're pushing at an open door. If you just introduce yourself and say, I'm here, would you like to work with me? There'll be somebody who'll take your hand off. And I think it's around looking at the work that's going on, how they could support you, how you could support them. And I think around adults and children's social care, I think it comes back to the point I was making before about not setting out a separate topic on climate action, but weaving it into what they're doing. So if they've got X problem, what would be the green solution to that?
Yeah. That's great. I think we've run out of time, folks. So there's loads going on in the chat. I can't keep up with the chat and try and coordinate questions. I realise I can't multitask, which I don't think is a thing anyway. But it's been a great session. So I really, really want to thank everybody for sort of coming and sort of participating in the discussion, but particularly to Tom and to Fiona and also to Lindy for just sharing some of the great work that's happening across the Northwest. And I think the message really is keep it personal and keep it like local and small, and that's how we get some of the messages across. Really, it doesn't have to be big scale, because it feels very overwhelming when we sort of talk about that. So I'll probably be told off if I don't do this. We've got an evaluation on this session. Also, we ask, I think, the question about what would you like to see from future masterclasses as well. So if you could take it only takes a couple of minutes, a few minutes, just to give us some feedback on this session and what you've got out of today, and maybe what we could do differently in the future. That would be really brilliant. There's a QR code there, and there's a link in the I don't know if we can post that in the chat so people can just get on to fill it. That's great. Thanks so much. And I think we're also doing a big plug for the next session. Yes, thank you. Next session, 10th of July, which I did mention in the green room. That is my birthday, so I'm not sure I'm going to be around that day, but it's on psychological safety as an enabler to innovation, engagement and productivity, and you can register for that coming up. We've done a couple of things on psychological safety actually, and they've been really, really great sort of masterclasses, so hopefully everybody will get booked onto that. And we'll try and maybe answer some of the questions if we can in the chat, if people want to, especially the panel. And that's it. So it's a farewell from me, and thanks so much for your time and being involved. Thank you. And see you again next time. lots of claps. Thanks, everyone.